Hi, my name's David Minkoff. I'm a physician in Clearwater, Florida, and I'm here today with one of my buddies, Dr. Frank Schellenberger. He's really a mentor for me. About 8.5 years ago, he taught me ozone therapy, changed my life. And today I really want to have an opportunity to get together with him because we have a product called Perfect Amino, and millions of people are taking this product. And there are questions that come up about it. How do we use it? How do we get the most effective use out of it? It's a product that helps all different kinds of people, from athletes to people who are very sick, to rebuild their protein structure within their body. So questions come up, and we thought today we'd get together and just discuss it so people could get the information from the source and really understand it better so that they can get the most benefit out of it.
Okay.
Hi, Frank.
Hey, David. How you doing? Yeah, thank you for giving me the credit on teaching about ozone. But the point is, I remember distinctly about 4 or 5 years ago when you presented at our conference and you were telling us about perfect aminos and this special balance of amino acids. And that was brand new news to me. I did not appreciate this concept about they have to be in balance. If they're not in balance, you're wasting all this stuff.
Right.
It's just going into metabolism. So, it's been a great trip for me also as well. And giving it especially to a lot of my patients who, need to recover, recover from illnesses, recover from, traumas that they've had where they've lost lean body mass. Mm-hmm. They're maybe sick and they need to recover. Maybe they can't, go out and eat as much food as is required to do that.
Right.
And they can do it very quickly and so easily with this powder.
Right.
So thanks for that too.
You're welcome. You're welcome. It's funny because when I started doing the prolozone, the ozone injection therapy, and I really liked it and I saw amazing benefits from it, that I found that if I gave every patient Perfect Amino with it, the results were really better.
Yeah, good point.
Because this was a stimulant to them regrowing their own collagen in the form of tendons and ligaments, and that if they had the sort of building blocks to do it, that they would do it faster and better. And that was really made the prolozone go better too.
So I have a number of questions that I made up.
Okay.
That I wanted to ask you and clarify a few things.
Sure.
These are some things that my patients have talked to me about, or I've gotten feedback from some other colleagues, and I just want to kind of check with you on what the deal is on this stuff.
Okay. Yeah.
So the first thing is people are asking, where do the amino acids come from? Where do you get them? Okay.
So amino acid, just to clarify the term, amino in Greek means nitrogen. Okay. So these are molecules that are made up of carbon, hydrogen, and oxygen. So the building block of an amino acid is the same as a fat or a carbohydrate because they're different mixtures of carbon, hydrogen, and oxygen. If you add a nitrogen to that, you get amino, and then it's in an acid form, so it's an amino acid. So all of the amino acids, there's about 22 that our body uses in order to build our structure. So amino acids make proteins. Proteins are hair and muscle and skin and liver cells and enzymes, and that's the structure of our body. So these are amino acids. It's kind of like an alphabet. There's 22 different ones. You put them together in different orders or different combinations, and you get different proteins. Now, some proteins are really simple, like...
So the body makes these proteins from the amino acids, basically.
Exactly,
yeah, okay.
Exactly. So these are
like
the building blocks.
Yeah, okay.
Exactly. So like the simplest amino acid is thyroid hormone. It's one amino acid, tyrosine, with iodines on it, 3 or 4 iodines, and so that would be the simplest one. But if you take something like skeletal muscle, I think it's 455 amino acids are part of that. So they can be very long and complicated. So insulin's an amino acid, and growth hormone's an amino acid. So the body has like over 50,000 proteins in the body that all have to be manufactured. So what we found, or what was discovered, and I didn't discover it, was discovered, is that there are 8 basic amino acids that if you have those 8, the body can make the other 14. And those are called essential because you can't make those. So if you don't get those in, you can't make them. Now, where do they come from? These can be extracted from vegetable products because, say, vegetable proteins have amino acids. They can be chopped up in the laboratory, extracted.
Is that where you get the amino acids for perfect aminos?
It's a mixture of vegetable proteins, and there are now bacteria that you can feed them certain things, and they will make amino acids.
Oh, okay, all right.
So there's two sources, but it's vegan. There's no animal sources.
Okay.
Some companies are making amino acids, and they're using feathers, or they're using animal parts. So these are
Okay,
pure.
all right.
So if you don't like to eat animals or destroy animals or do anything, we don't do anything with animals. These are vegan sources.
Yeah, well, that's something people ask about.
Yeah,
You know,
well, yeah. So they're clean.
And that's
they're
actually
pure.
some of the people that maybe need these things too, are the vegans.
It's the
They
most.
may not always get the perfect blend of aminos unless they're very, very careful, right?
It's totally true. And this
Yeah.
last weekend, I was doing a triathlon, and I'm standing in the water, about ready to start, and a patient of mine came up to me, and she said, "Hi, I just wanted to tell you," she's been a vegan for 5 years. And she came to me because while racing, she's breaking down, and she wasn't feeling well. And about 6 or 8 weeks ago, she came in for a check, and she said, "What can I do?" And I said, "You're vegan, you need amino acids. Before I even get your laboratory reports back, because I know you're going to be low, you start taking 8 of these." She's a little girl. "Take 8 of these twice a day between now and the next 3 months, and it'll build you back up." And she stopped, and we're standing waiting for the gun to go off, and she said, "It's made an incredible difference. I feel so much better. I'm recovering faster. I can feel my body's getting harder because I'm gaining lean muscle mass."
Yeah.
So very quickly, really. It doesn't take a long time.
Yeah. Good. All right. So that answers that question.
That's where they come from.
Yeah. Vegan. Good. Good.
Yeah.
All right. The other one I want to know is, so, what if you're not an athlete? What if you're not doing these incredible adventures that you guys do? What about normal people? How much should they take? And give me an idea of what you think.
Okay. So there's a couple things that go on with this. One is that if you're using your body, just physically, you are going to break down amino acids. So you lift boxes, you walk.
That's part of the body's remodeling all the time. It's
All the
constantly
time.
breaking stuff down and building it back up.
That's right.
That's what it does to keep us young.
That's right.
Yeah,
So
exactly.
there's a turnover.
Yeah.
There's this thing called protein turnover, and the proteins turn over. Now, they only turn over if they have amino acids to fill in where the old ones got damaged or broken, like our gut. Like in people who have leaky gut, part of the problem is that they're not turning over the inside lining of their intestine very fast. Instead of every 3 or 4 days, it might be 2 weeks. Well, those things are broken down. They can't screen very well. Or they don't have enough enzymes, so they don't digest their food. Or they don't have enzymes in order to make energy. And so if they're not there, the body makes do, but it isn't optimum.
Yeah, so even if you're not an athlete,
You need
even if
these.
you're just even if you're not sick, you're just a regular person.
Right.
You're going to be breaking down muscle as part of, and bone,
Right.
and skin, and
Right.
hair, and
Right.
you mentioned intestinal lining. You're going to be breaking down all that stuff.
Yes,
Just as a matter of everyday course in this process of the body remodeling.
exactly.
And the deal is, in order to replace that, you got to have the right amino acids.
Right.
And in order to get the right amino acids, you have to digest properly.
Right.
You have to have a diet that's really good, and a lot of people, it's not not perfect.
That's right.
Especially with respect to protein.
Right.
Yeah.
And you look at the grocery carts. If you stand in a big grocery store for 15 minutes and just watch what people eat,
Yeah.
you can see that it's far from optimum for most people. And the other problem is that there's an epidemic in this country now, and people are now taking many times medications that block stomach acid.
That's right.
There's something like 20 plus million prescriptions a month for like Zantac and Nexium and Pepcid and Tagamet. But now a bunch of these are over the counter, so you can just buy them. And when you take acid blockers for your stomach, you're not going to digest protein because you need acid in the stomach for protein to be digested.
Yeah, yeah.
And so a lot of people might even be eating enough protein, but they're not digesting it very well. And if they don't digest it very well, they're not going to get the benefit of their
And when
proteins.
even if you're not taking these medications, your digestion could be compromised anyway.
Right.
Even if you're young. Some
Right.
young people have compromised digestion. So you got a compromised digestion.
Right.
You got a diet that's maybe less than perfect.
Right.
And you need these proteins.
That's right.
And people are like always out there buying vitamins and minerals and such, but you don't think of like buying a protein supplement that normally, unless maybe you're a bodybuilder or something.
Right.
You know, you don't think of that.
That's right.
But what you're saying is that you should think about that.
You should.
To get optimal.
Right.
You know, not just to be alive, but to get optimal. You should think actually about taking some sort of amino acid supplement that can keep up with this turnover issue.
Exactly.
That's really neat.
And things like detoxification, because the environment is full, there's something like 80,000 plus chemicals that are in the environment. We're exposed to them all the time. Chemicals, pesticides, dyes, preservatives. And in order for our body to handle that stuff, we need a liver and digestive enzymes, which are proteins, to be able to break this stuff down and get it out of us. And if you don't have enough of those enzymes, you're not going to detox very fast, and you're going to have trouble. Same with, there's an epidemic now of people with depression, can't sleep.
That's right.
Anxiety. And, you know, there's millions and millions of people who get prescribed medication to try to handle these situations. In our practice, we measure levels of neurotransmitters. These neurotransmitters are all made out of amino acids.
Right, yeah.
And they're low. And we find that if we can replace their amino acids, they will then make their neurotransmitters, and they feel better, they sleep better, their depression gets better, and we're actually repairing a problem that the body's having so that we can restore their health.
Now, I don't know that all the people that are listening to us appreciate this. I know you do, but I don't know that they understand that you need the enzymes to break down the proteins to the amino acids.
Right.
But the enzymes themselves are made out of the amino acids.
Right.
So you could get a vicious cycle.
You do get a vicious cycle.
You don't have the enzymes to break down the protein. Now you don't have the amino acids to make the enzymes, so you now have fewer enzymes, and it's just, after a while, it's just not so good.
That's right.
And you can turn that around by taking some amino acids.
That's right, because these don't need enzymes to be broken down.
Okay.
And they're absorbed directly into the body, so you can bypass a lot of the problem areas. Like one of the things we do in my practice is a lot of people, we do stool tests where we can measure the levels of pancreatic enzymes in their body, and many people are really low, and it's exactly what you said. They're not digesting proteins, they can't make chymotrypsin and trypsin and these enzymes that are needed to digest protein, and then they can't digest protein. And then the thing just goes worse and worse and worse.
So the thing I'm thinking about also is these enzymes you just mentioned, the pancreatic enzymes that you use to digest.
Yes.
That's also released into the bloodstream.
Yes.
And those are anti-inflammatory.
Yes.
They go around and, and for a guy like you who's out doing these, these triathlons, by the time you're finished, you got to be pretty inflamed and pretty messed up.
Right.
And those amino acids probably make you recover a lot faster, I bet.
They do. Yeah. They do. And they keep my enzyme levels high.
Oh yeah, what I wanted to ask you also was, how long does a person, okay, let's look at two situations, a triathlete or somebody that's really working on that level, and like a regular human being. So how long does the triathlete need to take these aminos before he can see a difference? How long does a non-athletic type of person need to take the enzymes before they somehow can feel it or see it?
Well, this vegan girl, she felt it within a couple of weeks, like a really change. Some people feel a little bit faster. One of the experiments that was done with this product was to take elderly people who were too weak to even stand up out of a wheelchair. And they gave them 10 tablets of Perfect Amino, and in 45 minutes, they were able to actually stand up. So sometimes the lag between dose and response can be very short.
Yeah, depending on how deficient you are, maybe.
Right.
Yeah, okay.
I usually tell people, give it about 3 months, you're probably going to feel a difference. Some people have called us. I've had patients that after, so I gave it to them at day 1 of the visit, and 6 weeks I saw them back, and they were complaining that now their hair and their nails were growing too fast. Like usually they could go 6 weeks between hairdresser appointments, and at a month she needed a haircut because her hair was growing much faster because hair is protein. She had more amino acids.
Yeah.
Now she was getting her hair was growing faster.
So that would be a good kind of marker in a way.
It could be.
Yeah.
I mean, it's individual.
And one of the things you see as people get older is their hair thins.
Right.
Yeah. Okay.
Right.
What sort of doses should people take? How much?
Well, you need a dose enough to make an effect. So what generally we say is if you're under 120 pounds, take 7 all at once a day, about a half hour, 20 minutes before a meal.
Okay.
And you can take it with water, a sports drink, or juice, but don't take it, if possible, with any kind of fat or other protein.
Well, why not?
The uniqueness of this is the exact blend of these 8 essential amino acids. When it goes through your small intestine, it goes into your blood, and it goes into the cells can take 99% of that and turn it into protein immediately with no waste. So it's very powerful. Now, if you mix it with some steak or some chicken, or you eat, say, buttered broccoli at the same time, you're going to slow the digestion. It's going to get bound up with other stuff, and you don't get the full impact of it.
Oh, okay.
So it's better than nothing.
You could do it with other food, but you're telling us the best way.
This is the best way.
And you mentioned you take it with a sports drink or some juice or something with some sugar?
It can take sugar or water, either one. Doesn't need sugar.
Is there an advantage to taking it with sugar or water?
I don't think it matters.
Okay.
Well, my routine is every morning when I get up, I keep the tablet. I'm doing the powder because we do powder too. But I'm taking the powder. I get up in the morning. I go to the sink to wash up. I put 2 scoops of powder in a glass of water. I drink it down. And then by the time I've washed up and shaved and gone, it's 23 minutes is the magic number. And then it's in your bloodstream. And then you can eat whatever you want.
So you take 2 scoops every day?
I take 2 scoops every morning.
Do you, like after a race, do you take more? Or
I take more.
You do?
I do. So I raced on Sunday.
Okay.
So I took 2 scoops as soon as I got up. As soon as the race was over, it was about a little over 3-hour race, I had some with me. I had some Gatorade or sports drink with me. I put 2 scoops in there and I drank it down again.
All right.
Then later, before I went to bed, I took another 2 scoops.
Okay.
Now, I raced hard. I raced as hard as I could go that day.
Yeah.
I did good. And
if you can survive, you're doing good as far as I'm concerned.
Right.
Yeah.
Yeah. So then for the next 2 days, I took extra doses. I took 2 extra doses for the next 3 days. Now here's why. Here's what I found. And a lot of the athletes that we work with.
So you're talking about 3 times a day now?
3 times a day for the next 3 days.
All right, okay.
Now, I did that for one reason. After an intense effort like that, there's a lot of wear and tear on the body. And anybody who's trained for a race knows that if you trained hard and then you do the race, the chances of you getting an upper respiratory infection within a week after the race is pretty high. Okay? Now my theory on what happens is that the body's broken down from the race. It's demanding amino acids to repair tendons, ligaments, muscles, all this stuff. But also, and when it does that, it's pulling away from keeping your immune system up. And so you get an immune sag, and then you get sick. And so what I found is if I extra for like 3 days, and then go back to my routine of 2 scoops every day, that I don't get sick. And it worked again this week. It's now Wednesday. I raced on Sunday. I took it Monday, Tuesday, took a dose this morning. I'll take another dose tonight, but I'm feeling fine.
How about injuries? Does it somehow, do you find you get fewer injuries, fewer muscle strains, things like that might be a problem?
Yeah, which is how I got into this thing in the first place. I'd pulled a hamstring really bad in a race. And for 2 years, I could not really get it to repair. And I did everything short of injecting ozone because I didn't know anything about ozone at the time. But I did chiropractic and massage and acupuncture and homeopathics. I mean, I did everything. And it just wouldn't heal. Every time I go
out, 2 years?
About 2 years. Every time I went out to the track, I'd try to do hard. I couldn't do hard. I knew I would pull it. And I was looking around, and then I got a friend showed me this perfect amino formula. I took it, and within about 6 weeks, my hamstring really healed. And I noticed a bunch of other things that were just like I couldn't even fathom. That my maximum heart rate increased by 12 points. So my highest heart rate on test had been 174.
Okay.
And after a couple of months of taking Perfect Amino, it went to 186.
Wow.
And that was going up an 18-degree hill with 100 degrees outside. And I was trying to just push it as hard as I can. And I hit a new maximum. I also that year did Ironman Canada, got my best time ever. And I felt stronger. And the other thing that happened to me, which I didn't anticipate at all, is that I put on about 12 pounds of lean body mass. And I was actually concerned about it because I saw my weight climbing, but my waist didn't change.
Yeah.
I couldn't see a physical difference. And when I talked to the scientist who had developed the product originally, he said, and I had been a vegetarian, he said, you're filling in all the proteins and bone that your body was deficient in.
Wow.
And that's where the weight
That
was
was
going.
12 pounds in 1 year?
Yeah.
Okay, that's a lot.
It's a lot.
It's a lot of lean body mass, I mean. Yeah,
It
that's
is.
a
And I
huge
wasn't
amount.
doing anything but my
Yeah.
routine. But I was depleted, and it was just replenishing. The body was
And you
fixing
didn't even
itself.
know you were depleted, is the point.
I didn't know.
So, I mean, how many people are out there that are depleted? I'm kind of thinking of myself a little bit as you're talking.
Yeah.
Because, I've been preparing to do this bicycle ride. I was talking to you a little earlier about it.
Yeah.
And so I'm going out for like 3-hour bike rides now to try and get ready for it. And I've been having, a certain pain on the lateral side of my left knee.
Yeah.
Is just like hurting after about an hour and a half. I
Yeah.
bet if I take this stuff, it'll go away.
I would.
What about patients that just have pain?
Yeah, well, if they got pain, usually
They're not athletes. They're just walking around with this hurts or that hurts, or the back hurts, or it's things like that.
yeah, it's a repair. I mean,
So you actually can see people get better from that.
I can.
Wow.
And we get testimonials about it all the time about, like, I was my orthopedist's favorite patient because I was always injured and I always needed something, and now I don't have to go see him because I feel better and it's not bothering me. There's one other interesting story on this, which I have a patient who is an expert in treating with pancreatic enzymes. Remember before we were talking about pancreatic enzymes. So she had expertise in treating patients with pancreatic enzymes. So these are real high doses of enzymes.
Yeah.
And the guy who discovered this said that you could test yourself, and what you should do is take 12 tablets of these enzymes 3 times a day for 3 days and see if something flares in you or you get sick or something goes. Then you take them till all the symptoms go away. So she was down for a visit one time in the office, and she said, and I'd read the book, and I said, I'd like to try this. So I took 1 dose of these 12 tablets of these super strong pancreatic enzymes on an empty stomach, first thing in the morning, and within 2 hours I felt like I had burned a hole in my stomach. Like it was really bad, and I had to take antacids and all this stuff because I really thought I'd hurt myself. And I went to her and I said, I don't know, I can't take these things. I don't think I have cancer, but I can't take these things. It was about a year later when I found Perfect Amino, and I was taking it, and I had all these other changes in my body, and I thought, what if part of the stomach lining, the generation of mucus that is supposed to be there to protect the stomach from these enzymes, what if that's part of the amino acid deficiency or protein deficiency that I had?
Yeah.
So I said, okay, I'm going to try it again. I took 12 tablets, no reaction. Before lunch, 12 more. Before dinner, 12 more. I did 5 days. I had nothing. So it worked. I mean, it worked on a level that I didn't anticipate.
That's kind of, you were also intimating with the leaky gut thing.
Yes.
People have these food intolerances.
Yes.
Maybe they amino acid deficient.
Yeah.
And their food intolerances would actually go away over time.
Well, it's sure worth a try.
It takes something like 6 weeks, I think, to turn over your gut, doesn't it? Something like that.
Well, probably maybe the whole thing, but the intestinal lining, it's 4 or 5 days.
4 or 5 days.
It's pretty quick.
So you should see, if you've got a leaky gut thing.
As part of it. Clear out the parasites and the yeast and the rest of stuff too. But I certainly give it to everybody.
Okay,
Yeah.
You give it to like everybody, don't you?
I give it to everybody.
Yeah.
Everybody comes
Healthy,
in.
well, whatever.
They get it.
That makes sense.
Yeah.
Is there a particular age you like to, I mean, you don't give it to like 8-year-olds, do you, or do you?
I do.
You do?
Well, we powder now. It's easy. They'll drink it. They like it. It's lemon lime.
Okay, all right.
I don't know if I told you the story. I had a patient come up on a 1-day discharge from the hospital. It was an 8-month-old baby. And the baby was in the hospital because when he was born, his skin didn't close over his intestine. And when he was born, his intestines were out.
Wow.
Okay? So the surgeon had to push everything back in, close it up. It was under great pressure, and the bowels wouldn't move. And so they put a central line in, and the baby was getting intravenous feedings with proteins and fats and the rest of the stuff for a period of 8 months. And the intestines still weren't functioning very well. The baby was able to take a little bit of water, but not very well. The baby from the hyperalimentation formula got hepatitis, and they couldn't use the formula anymore. And the mom took him out of the hospital on a day pass to come up and see me. And the baby needed protein. He hadn't grown at 8 months. He was still only 8 pounds.
Wow.
So he's just a little shriveled up little thing. I gave him 2 tablets of Perfect Amino mashed up in a little sugar water and a little diluted applesauce twice a day. And he started to gain, just on that, and the vitamins and minerals and fats that they were able to give him intravenously, started to gain a pound a week. And by age 2, he was normal size and had normal development. It was remarkable.
That's amazing.
Yeah. So it's very powerful, and it can really help people, whether you're sick or not, because when we measure people's blood for essential amino acids, almost everybody is low. And it's because there's a problem with our intestines.
Yeah, it makes you wonder too, because I know you know this, but where do they get these normals for amino acids?
Right.
You know, what's the normal? Like
Right.
from the way we're having this conversation here,
Yeah.
you think they're probably, everybody out there is probably abnormal unless they're doing something about it.
Yeah.
Or close to everybody, anyhow.
It's a good
Because they
question.
got who's got a perfect diet?
Right.
You do probably, but you know.
Well,
maybe
not always. Not always.
Yeah, but it's
But
really,
you know, it's
amazing.
It's
yeah.
right. It's like the thyroid thing. Like I use the bioenergy testing that I got from you, and it's remarkable. The labs usually aren't any good. I just go by their M factor,
Yeah,
by their metabolism factor, and that seems to be right on almost all the time. And there really isn't a standard for amino acids, so that's an interesting question.
Great. All right, let's see. So one of the questions people have asked is there a different dose for men or women?
So as I said before, like under 120 pounds, probably 7, and you have to take them all at once. So if you don't take two
They're 1 gram pills.
They're 1 gram pills.
Okay, so 7 grams.
7 grams.
Okay.
Would be like a once a day regular dose for people.
And that scoop is 5 grams, is that right?
The scoop is 5.
Yeah, okay.
Okay, so it'd be a scoop and a half
Yeah,
if you're
okay.
under 120 pounds.
All right.
If you're over 120 pounds, what I suggest is people take 10 tablets or 2 scoops
Okay, all right.
as a daily dose. And if you have trauma, if you are super stressed, if you know, whatever,
You're debilitated.
you take more.
Yeah, okay.
So if I get someone whose serum amino acids are really low and I can see they're debilitated, I'll give them at least 2 scoops twice a day, sometimes 3 times a day, to build them up.
So there's no difference between men and women necessarily. It's really you're going by weight.
Right.
Okay. All
Right.
Okay.
And you can't overdose on
yeah.
them. I think if you take more than 30 grams a day, you're probably wasting it because your body can't use it. Like the experiment was done where an adult male who weighs about 180 pounds for 2 years ate fruits, vegetables, and pasta, no protein, and just took Perfect Amino, 10 tablets 3 times a day, and did a program where he did heavy bodybuilding.
Okay.
I think he gained about 20 pounds of lean body mass over 2 years.
Jeez.
I mean, he's one of these guys that just has, like you
Yeah.
feel his arm and is like, is that even a human arm?
Yeah.
But his only protein source was Perfect Amino. So it is a full, complete protein, and probably 10 tablets 3 times a day would be enough for anybody.
Yeah, 'cause I remember to that regard, I remember that there was a study published on weight loss.
Right.
And they were putting people on, a very low calorie thing to lose weight.
Right.
And they gave some people this actual blend, this
Right.
Perfect Amino blend,
Right.
and the other group they just went without the blend,
Right.
and they lost lean body mass.
Right.
This group did not, and they were on 2 scoops, I think. So they were on 10 grams.
Right. We've done that actually in our office with
Yeah.
people who are put on like an HCG diet where they're on low 500 calories a day for 21 days. And we found that if we gave them 2 scoops of Perfect Amino, that they didn't lose lean body mass. But the studies have shown that on those low-calorie diets, if you don't take this kind of thing, for every 4 pounds you lose, 1 pound is going to be lean body mass. So you're going to eat your muscles up and your proteins in your bones. So if you're doing weight loss, these, by the way, have practically no calories. 10 tablets is only 4 calories. So you can take this stuff, and for weight loss it's really good, because if you substitute 10 tablets for, say, a big steak or a chicken breast, they're going to have 200 to 500 calories depending on the portion. Whereas if you take 10 tablets of Perfect Amino, it's only 4 calories. So you can get the nutrition that you need without all the calories.
You know, fasting is a good thing to do.
Yeah.
Like intermittent fasting.
Yep.
Sometimes with sick people you do even longer.
Yep.
I like to do the intermittent.
Yep.
Because it gets me the ketones.
Yep.
I feel better.
Yep.
This is a good thing.
Yeah, and this won't take you out of ketosis. I do intermittent fasting, and it doesn't take me out of ketosis.
Because protein, as a rule, will.
Protein will, because most of the protein gets
catabolized.
turned into carbohydrates.
Yeah, so this is not.
This doesn't.
Yeah, very cool.
And we've had some diabetics where, you know, they've got indwelling glucose monitors, and they take Perfect Amino and their glucose doesn't change. So that's really good for them too, because proteins will raise it, and of course carbohydrates will raise it. So if they want to control their sugar better, Perfect Amino won't change it.
I like it.
Yeah.
Okay. Let's see, what else do I have here? Well, we just answered that one about the ketones. And we looked at other benefits other than muscles, because, just to reiterate,
Yep.
we're talking about lean body mass.
Yeah.
But literally, every enzyme in your body is made out of these amino acids.
That's
all
right.
the building blocks.
That's
everything.
right. That's right.
Yeah.
And bones, like if you look at it's mostly women, but some men too. They'll do a bone density at age 50, and they've got osteopenia or they got osteoporosis. And the usual prescription is, we'll just take more calcium.
Yeah.
But calcium doesn't make bones go into bones. These women, if you look at it, bone is about 50% protein, collagen, and it's about 50% calcium phosphate. And if the structure of the collagen isn't there, the calcium has nothing to stick to. So it's kind of like the old walls that people, like the lath and plaster walls. They'd put up these strips of wood, and then the plaster had something to stick to. In humans with protein, amino acid deficiency, which many people have, especially women as they age, they're not getting enough proteins to keep their bones up, and they lose the collagen, the structure of their bones, then the mineral doesn't stick. And we found that if we give them Perfect Amino and make sure that vitamin D and hormones and the other factors that that are important, they'll make bone, and they'll grow new bone.
And the other thing, while you were talking, I'm thinking there's a couple of studies out there that talk about taking collagen for wrinkles.
Yes.
Have you seen this stuff?
Yep.
You actually take collagen in, and on some of these studies it's improved the appearance of wrinkles and such.
Yes.
I'm imagining this might do the same sort of thing.
Well, it's actually,
that's where you get your collagen from. Is that right?
It's actually better than the collagen. See, collagen it's usually a beef protein.
Right. Yeah.
And if you look at the percentage of collagen or bone broth or however you want to take it, that the body, so that's a protein. It's coming in. It's getting digested. It gets turned into amino acids. It has to be absorbed. Only about a third of that is going to be turned into your body. It doesn't go collagen outside to collagen inside. It's got to go through this degradation process and restructuring. Perfect Amino is 99% converted into body protein. It's way better than collagen.
I've never had much luck with that collagen anyway.
Yeah, I haven't either.
It's pretty good for arthritis, though.
Yeah, it can help.
And so what about arthritis? Have you treated patients, with like osteo or that kind of thing?
Yeah, no, I tell you, I give it to everybody.
Like the arthritis in the hands and such?
Yeah.
Okay.
And
you see
glucosamine, things like that can be helpful. A lot of times they have gut issues, and that's why they're leaking stuff across, and it's getting into the joints and causing symptoms. So if we can, so we have to just make, this isn't a one-shot heals everything. But I think as part of an overall program for health, that most people will find a real benefit from it, and they will know it, they will feel it. Like,
see, I tell you, for me, it's kind of like a new paradigm in a way. Because you just don't think of protein, at least I don't, you think I'm eating food, I must be getting protein.
Right.
But there's a whole lot of reasons why that's not necessarily true.
Right. And I think a lot of it has to do also with the environment, with the toxicity levels, with the poor guts that most of us have. And so we need to just sort of think of strategies that are going to bypass those things so that we can survive in this toxic environment and still have fun.
Yeah. Yeah, I think most of us realize it's, even though you have a pretty good diet, maybe even a really good diet, you're likely to be deficient in something, so most of us are going to go out and take some sort of multivitamin or something like that, just figuring, well, there's a pretty good odds that there's something in this formula that's going to do me some good.
Yeah.
This makes total sense too.
Yeah.
In that way.
Yeah.
Are these building blocks for hormones as well?
Well, they are in that, the basic particle that hormones are sourced from is cholesterol. But it then takes enzymes to transform that cholesterol into testosterone, estrogen, hydrocortisone, whatever it is, aldosterone. And it's having enough enzymes so that the body can actually do the conversions.
And once again, the enzymes are made
amino acids.
From these amino acids.
Yeah.
It's wild.
Yeah.
All right, so I think the last question I have for you is, how about brain function? You mentioned a little bit about neurotransmitters.
Yes.
Have you seen actual brain function or cognitive function improve?
Absolutely.
Really?
Yeah. There's a physician out in Hawaii who has he's the physician for a home where people come because they're too weak to take care of themselves or they don't have the mental function to be able to take care of themselves. And he started giving patients Perfect Amino, 10 tablets every day, as part of their routine. And what he found was many of these patients would regain enough strength to go home or regain their mental facilities so that they could now bathe themselves, eat for themselves. They still may be part of his structure, but that there was a vast improvement. And he was amazed by this. And it's interesting because you look at the basis of these neurotransmitters, serotonin, melatonin, vitamin B3, the basis is tryptophan, okay?
Right.
It's an essential amino acid. It's part of the mixture of Perfect Amino. Tyrosine is not an essential amino acid, but phenylalanine is, and the body is supposed to take phenylalanine and make it into tyrosine. You got thyroid hormone, you got dopamine. These are basic things, and a lot of people are malnourished. They're not crazy. They don't have a psychological disease. They're actually deficient, and if you can get their body nutrified, they can improve.
So you need, for example, you need tryptophan to make serotonin.
Yes. Melatonin.
But if you just go out and just take a whole bunch of tryptophan, you're not really getting it balanced. There's got to be other things, and you're probably going to throw something out of whack after a while.
That's right.
Yeah.
That's
so
right.
it's important to take something that's in balance.
That's right.
Otherwise, down the line, you're probably going to create some other problem, you'd think.
Yeah, and it doesn't really work. Some of the companies that manufacture these tests give a suggestion, okay, your amino acids are this level. Now, here's the amino acids that you should take in order to replenish those. And it doesn't really work because they're not in the right balance.
I've never found that to work.
They don't work.
Yeah,
but if you take Perfect Amino, they will provide the balance. And usually if you retest people in 3 to 6 months, you find that, yep, they're going into balance and their health improves with what you're doing.
As we're talking, I'm also thinking, hey, why wait until you're not thinking straight? Why not just, do this now?
Oh, of course.
So you don't get to that point.
Of course, of course.
Yeah, so it's a whole preventive angle. Let's say you're feeling perfectly well, and you don't have a problem, and you're 50 years old or something, or 40 years or whatever, and you're getting up there. Well, what are you going to do? Wait until there's a problem and then take the Perfect Aminos? Why not just make that part of your everyday routine like you do?
Right.
Makes all the sense in the world to me.
Yeah. Absolutely. I hear people at 40 saying, I'm getting there, and it's like, no. Yeah. I mean, you and I are as active as we've ever been, both in our careers and our activity levels. And I'm not planning on retiring soon. And you know, I'm only a couple years behind you, but I'm looking at, I want to set the record at Ironman Hawaii when I'm 85. You know, it's just like we just got to keep it together. And if you have proper nutrition, and especially with amino acids, since we're talking about that, you can maintain your body function and you don't have to break down. Just one other thing on this, which is interesting.
Okay.
At USC, they did a study. You know, with aging, the average person loses about 20 to 25% of their lean body mass between age 20 and 60. And the question they asked was, is that just a necessary side effect of aging? So they took 60-year-olds where they were able to give them amino acids intravenously that were labeled to see could they make protein out of the amino acids at a 60-year-old as well as a 20-year-old. And they found that they could. That the cell basically wasn't retarded or old and it couldn't do it. It could do it if you gave it the right stuff. So my theory is keep giving it the right stuff because you'll age. None of us are going to make it out of here alive. But we can go as long as possible and enjoy ourselves, why not? And 2 scoops a day is 10 tablets. Take it every day. On hard days, do a little bit more, and it can help you.
Well, look, I want to thank you for bringing this stuff up. I mean, you've taught me a lot about this, and I think that, you know, they don't teach this in medical school.
No.
And really, I just never really understood the fact that that's a good supplement to take, a protein supplement. I never, you know, thought of that. So I'm thinking of athletes do that, but for like regular people from a preventive aspect doing that.
Yeah.
So I mean, other than the fact that it takes care of wrinkles, takes care of your brain, takes care of your bones, takes care of your hair, your skin, your eyes, your digestive system, gets rid of your allergies. Other than that, it doesn't do much.
That's right.
Is that right?
That's right.
Okay. All right.
That's right. And menopause. You know, like my wife, if she doesn't take it for 2 days, she feels tired. She's like, I'm tired now. What's wrong? Oh, I forgot to take my perfect amino. It has effects that you know, in each person can be a little bit different, but I just think people should try it. It's one of these things. I take a bunch of stuff that I'm not sure it's doing anything because I can't tell.
Yeah.
But I take it anyway. But this stuff, I can tell. Faster healing, faster repair. If you're a bodybuilder and you want to build muscles, don't take whey protein. Take perfect amino. It's easier on your gut and you'll build muscles faster.
Okay. Perfect.
Great.
Well, thanks for answering all these questions. That was great.
It's a hoot. It's great to get together with you and just love it. You're a wealth of information.
I'll let you know how my knee turns out.
Okay. Okay. Good. Good. Thanks.